Jain Institute of Vascular Sciences, Jivas, a unit of Bhagwan Mahavir Jain Hospital.
PVD or PAD, Peripheral Vascular Disease, wherein arteries in the lower limb gets narrowed leading to inadequate blood supply to the lower limb. It can also happen to various different body parts such as upper limbs, neck vessels or any other viscera in the body. PVD occurs because of a deposition of a plaque, which is a material made up of fat and cholesterol in the blood vessels, and this process is known as atherosclerosis. The commonest risk factors for developing peripheral vascular disease are tobacco consumption, diabetes mellitus, hypertension, age. Symptoms of peripheral vascular disease: claudication pain, pain on walking for certain distance and that pain relieved on taking a rest for a while. Rest pain, wherein pain is very severe burning kind of pain which is more at night and which is so bad that a person cannot sleep comfortably at night, not relieved by adequate pain medication. Other symptoms of PVD are non-healing ulcers over the foot, gangrene of a toe or forefoot. Gangrene means death of a tissue. Wherever there is absence of blood supply, which could be to the foot, toes or the fingers. How do we diagnose PVD? First and foremost, a detailed clinical examination of all peripheral pulsars by a vascular surgeon, followed by some non-invasive test like ankle brachial pressure index and or arterial duplex scan. Non-invasive vascular intervention. CT angiography, MR angiography gives detailed information of arterial blockages. Angiographic can be performed for any blood vessels from head to toe. And there are different types of angiographies, traditional method called DSA or with machines called CT angiography or MR angiography. How do we treat peripheral vascular disease? The objective of treatment is to improve blood supply to the leg and thereby to offer symptomatic relief to the person. First and foremost thing is to control the risk factors like stop tobacco consumption, a good control of sugars, blood pressures and abnormal lipids. Certain medications like cilostazol, vasodilators, certainly helps in improving walking distance, and blood thinners like aspirin and clopidogrel will help. These days, a newer class of anticoagulants are also used to prevent further progression of disease. In advanced cases, we need to offer them either an angioplasty or a leg bypass operation. Angioplasty means dilatation of an occluded or narrow blood vessels, which is a simple, safe and effective procedure, which is done through a small puncture of an artery. It is not a major operation and a blocked artery is opened with a balloon. If it does not stay open with a balloon, a stent is deployed in the artery so that the blood supply can be restored. In the lower limb bypass operations, we bypass the blocked artery above and below either by vein graft or prosthetic graft. Not all the blocked arteries require surgery, they can also be treated with medications.